Hi, my name is Kate Sweeny, and I'm a professor in the social personality area of the Department of Psychology at UCR. And I'm going to share with you my favorite finding from my COVID-19 research. In this particular investigation, we were interested in the question of whether flow and mindfulness might mitigate some of the negative consequences of quarantine. Mindfulness is a state of focused attention on the present moment, on the experiences one's having in the present moment, and kind of observing those experiences without judgment. Flow is also a state of focused attention, but on an activity that you're engaging in. It's like being in the zone with an activity such that time flies by and you lose self-consciousness. In this particular investigation, we recruited over 6,000 participants from China during the peak of the COVID-19 pandemic there. This study was conducted on social media. You can see that the sample was relatively young, and about a third of the sample was in quarantine at the time that they filled out our survey. Remember that during this period of time, quarantine was a pretty severe type of lockdown where people really couldn't leave their house. And we were interested in well-being during this experience. So we looked at emotional well-being, we looked at worry about contracting the virus, at loneliness, and at health behavior. And then of course we asked how much flow and mindfulness people experienced in the previous week. So what did we find? Well, first of all, unsurprisingly, both flow and mindfulness were good for well-being. We know that from lots of previous research, being mindful and being in flow are both really good for you under almost any circumstance. But what about the experience of quarantine? So not surprisingly, we also found that people who were in quarantine during this period were worse off in terms of every measure of well-being than those who were not in quarantine, unless they were experiencing a lot of flow. So if participants reported being in a flow state a lot during the previous week, it didn't matter whether they were in quarantine or not, they were equally well off. Mindfulness, on the other hand, did not have this effect, although it was good overall. And that's my favorite finding from my research on COVID-19.
Hello, my name is David Funder. I'm a professor at the University of California at Riverside, and I'd like to share with you just one favorite finding and maybe some interesting implications from some research we've done recently relevant to COVID-19. For some years, we've been conducting an online survey. Actually, we've been doing it all over the world, in which we've used an instrument called the Riverside Situational Q-Sort to ask people to describe any experience the previous day that you happen to remember well. And as part of this research, we gathered responses from UCR undergraduates from March to December of 2017, as you know, long before we'd ever heard of COVID-19 or the impact it would have on our lives. After the governor's shelter-at-home instructions last spring here in California, we decided to restart our data gathering to compare how things might be described now or then under COVID isolation and restrictions compared to how things had felt years before. So the period of this second data gathering was between April and June of last year. So how was experience different? Well, back in 2017, people were more likely to rate their experiences of daily life as characterized by the possibility to develop new relationships, by talking a lot, by being involved in social interaction, and by having more potential or actual romantic partners physically present with them. But during the shelter-at-home period of last year, suddenly people started rating family as more important, probably because many of our participants were living at home again. They also said people were disagreeing about something, maybe reflecting some of the tensions of living at home with people who weren't used to necessarily being together so much. Also, of course, people felt more emotional threats and felt, of course, that the situation was more relevant to their health. And that was distinctive aspects of the experience of people last spring as opposed to a couple of years earlier. How was experience the same? Well, surprisingly, we also threw in a question saying, overall, was your experience positive or negative? And we asked them to rate that on a 9-point scale. The two ratings were almost identical. They were not statistically significant, meaning in statisticians' terms, that any difference we saw could have just been due to chance. So, based on that, what comes next? Well, as we come out of this pandemic in the next few months and years, expect disagreement, emotional upset, and health concerns to be less common. Family to be somewhat less important than it's been over the past year. But new relationships, talking, social interaction, and romantic pursuits are more likely to become more important. But Alas, perhaps the overall positivity of experience won't change much. If you felt good last year, you'll feel good next year. If you didn't feel so good last year, you may not feel much different next year either, even though these elements of experience can be expected to change. So that's my favorite finding from that research, and thank you for listening.
Hello, everyone. My name is Sarah Knapp, and I'm a doctoral candidate at UCR. Today, I'm going to discuss my favorite findings from a study we conducted on coping with COVID-19 using memes. So the pandemic has been hard and stressful. We've been impacted by illness, financial crisis, job loss, lost relationships, and certainly many have lost lives. But there are other more benign, still important things that we've grappled with within the last 14 months. Things like missing out on milestone moments, people hoarding toilet paper, some refusing to wear masks, losing the ability to go outside freely, some getting to work from home while essential workers could not, some feeling like they have not taken appropriate self-care, and having to go against our fundamental need to be physically close to each other. All of these issues on the right and more are ones that we have grappled with, and they are represented in COVID-19 memes. So importantly, there are also violations to our standards for normal, cooperative, functional social behavior. For example, here you can see that hoarding toilet paper depicted in this meme exemplifies a betrayal of the group's needs. So this meme depicts a theme of loyalty betrayal. So we categorized 300 memes as depicting one of these moral foundations, asked 352 people to rate how much they related to each meme and which moral foundations they cared about most. We found that people who reported sharing memes with others reported feeling more social support. And we also found that overall, people related to memes that depicted the moral themes that they personally cared about. So people particularly concerned about loyalty or betrayal to the group related more to memes like this one. People particularly concerned about authority subversion tended to relate more to memes like this one. So concern for each moral foundation predicted relating to memes depicting that moral foundation for all except for the cheating fairness domain. So this style of socializing may be a way that we are coping with people in our society violating the aspects of normal group behavior that are most personally meaningful to us. Thank you for letting me share my COVID-19 research.
Hello, my name is Lilian Azer, and I am a graduate student in the Cognition and Cognitive Neuroscience program in the Psychology Department. I will be presenting one study conducted in our lab titled Working Memory Capacity Predicts Individual Differences in Social Distancing Compliance During the COVID-19 Pandemic in the United States. We know that there may be shared neurocognitive mechanisms underlying working memory capacity and social norm compliance in the prefrontal regions. Working memory is closely related to the prefrontal mental processes which involve cognitive control and decision-making. And social norm compliance has also been related to the prefrontal regions where stimulation over the prefrontal cortex can improve social norm compliance. In other words, we're learning new social norms without having prior knowledge or repeated experience. And core cognitive functions such as working memory can play an important role in social distancing compliance. Therefore, in this study, we were interested in investigating how our core cognitive functions, namely working memory, associated with individual differences in social distancing compliance during the early stage of the COVID-19 pandemic. We collected data during the initial stage of the pandemic from participants recruited on MTurk. Participants completed a visual working memory change detection localization task, where they saw a set of 5 colored squares during the study phase. And after a short delay, they saw another set of 5 squares where one color changed and the other colors were repeated. Participants were asked to select the square where they saw the color being different from the initial study phase. Participants also completed questionnaires assessing social distancing compliance, fluid intelligence, personality, and mood-related covariates such as depression, anxious feelings, and sleep quality. We found that individual differences in working memory capacity could predict social distancing compliance, and this relationship remained even after we controlled for sociodemographic, fluid intelligence, personality, and mood-related individual differences. We interpreted this relationship to be partly due to an increased awareness of the benefits over the costs of social distancing among individuals with higher working memory capacity. Choosing to follow the social distancing norms and putting societal benefits over personal costs is contingent on working memory capacity. This relationship can also be generalized to compliance with other set of rules for social interactions, specifically fairness norm compliance.
Hello, my name is Melissa, and I'm a third-year graduate student advised by Kate Sweeny, and I'll be presenting my favorite finding from our COVID-19 research regarding the role of expectations and well-being during the COVID-19 pandemic. The relatively sudden onset of the pandemic prompted great uncertainty in our lives. Many of us were wondering, will I catch the virus? Will a loved one catch it? And how long will life be disrupted? And how long will stay-at-home orders last? In this study, we investigated expectations for these uncertainties as predictors of well-being in both China and the US. To answer our research question, we surveyed 4,969 participants at the height of the pandemic in China and 559 participants at the onset of the pandemic in the US. These surveys asked about perceptions of risk for themselves or a loved one getting COVID-19, expectations for the length of quarantine or stay-at-home orders, one's dispositional tendency towards optimism, and worry, positive and negative emotion, depression, anxiety, and loneliness as measures of well-being. We then ran regression models that predicted our well-being measures from dispositional optimism, COVID-19 risk perceptions, and quarantine length expectations. Effects of sex, age, education, income, and household size were also included in each model. This table depicts the results of different multiple regressions with well-being outcomes on the left and dispositional optimism, quarantine length expectations, and risk perceptions as predictors in each model. So we can see here that those in China and the US who are low in dispositional optimism report experiencing poorer well-being, which is consistent with the well-documented link between optimism and well-being. Whereas those high in risk perceptions for COVID-19 infection and those with longer quarantine length expectations consistently reported poorer well-being in China, these predictors were less consistent in the US. Risk perceptions for contracting the virus related only to greater worry, negative emotion, and anxiety in our US sample, whereas realistic expectations about risk of infection may be useful for prompting safe, healthy practices like mask wearing. Our findings suggest that high-risk perceptions may also be detrimental to well-being. And finally, expectations for quarantine length predicted only worry and negative emotion in the US. Depression, anxiety, and loneliness were not related to quarantine length expectations in the US, perhaps due to the flexible nature of American stay-at-home orders. Thanks for allowing me to share my favorite finding from our COVID-19 research.
Hi everyone, my name is Karynna Okabe-Miyamoto, and I am a PhD student working with Sonia Lubomirsky at UC Riverside. Today I'll be presenting a quick snapshot of our chapter for the World Happiness Report, which focuses on changes in both social connection and well-being during the COVID-19 pandemic. So we first wanted to see whether or not social connection and well-being within the literature in 2020 has shown increases, decreases, or no changes in social connection and well-being. And as you can see here, the results are quite mixed. These are just a couple examples here, but we do find a lot of mixed results within countries, like within the US, between countries, like between the US and the UK or with France, and also for both social connection and well-being. So given all of these mixed findings, we decided that understanding the psychological, social, circumstantial, and time use differences among people across the globe might help us to identify potential protective and risk factors for both well-being and social connection. So for example, for well-being, consulting a larger number of online news sources, as well as spending more time engaging with online news sources, are both shown to be risk factors for worse well-being. Perhaps because overindulging in these news sources does less to quell our fears and at some point begins to fuel them. However, gratitude, resilience, grit, and experiencing flow, which is a study, the flow study here you can hear more about from Professor Kate Sweeny here at UCR. All of these positive psychological characteristics were protective of well-being during the pandemic, as these characteristics might have helped people to cope. For social connection, one's occupation, such as being a healthcare worker, was found to be a risk factor for social isolation, perhaps because friends and family might avoid them due to the increased risk of COVID-19 exposure that their profession involves. And finally, because many of us were and are sheltering in place in our homes, it appears that who we live with is protective of social connection. Particularly living with a partner was found to be especially protective of social connection, perhaps because of the support that they lend during times of stress. This was just a quick snippet of the impressive work that we covered in our chapter for the World Happiness Report. If you have any questions or would like to chat about social connection or well-being, feel free to reach out. Thank you so much.
Hi, my name is Annie Regan, and I'm a doctoral student in Sonia Lubomirski's Positive Activities and Wellbeing Laboratory. Today, I'd like to tell you about a longitudinal study I conducted with my colleague, Karynna Okabe-Miyamoto. In February of 2020, our lab was running a study focused on social connection. After social distancing measures began to be widely adopted as a result of the COVID-19 pandemic, we decided to follow up with these same participants in early April, then again in mid-May of 2020 to see whether their sense of social connection and well-being had changed over time. Our participants included 299 adults recruited from prolific research. At all 3 time points, we measured participants' well-being through the satisfaction with life scale, overall sense of connection using the balanced measure of psychological needs relatedness subscale, and used a measure called the Comprehensive Inventory of Thriving, which included subscales to assess the degree to which participants felt they were learning new things and using their skills in their daily lives, among other things. One interesting finding from our study is that changes in participants' sense of social connection from February to May were associated with changes in life satisfaction. In other words, participants who experienced an increase in social connection from February to May also reported increasing in life satisfaction. Likewise, participants who declined in social connection also declined in life satisfaction. We also found that participants who reported that they were using their skills more in their daily lives over the course of our study seemed to be buffered by decreases in life satisfaction, predicted by decreases in social connection. You can see that here on the left side of the graph where the green line is the highest. We found a similar pattern for learning, such that participants who reported learning more over the course of our study seemed to be buffered from decreases in well-being predicted by decreases in social connection. This study provides initial evidence that learning something new or using your skills in daily life could help offset decreases in well-being associated with decreases in social connection. Thank you for listening to this summary of our research on social connection and well-being in the context of the COVID-19 pandemic.
Hello, my name is Darian Dick. I am a research assistant in the Life Events Lab, and I'm here to talk to you about the well-being in the age of COVID-19, the effects of social distancing. So in March of 2020, the World Health Organization declared COVID-19 to be an international public health emergency and recommended social distancing and other isolation practices in order to help reduce the spread. So we wanted to know, how does social distancing affect well-being? And we asked well-being because it's associated with a host of beneficial life outcomes. And so specifically, we wanted to know, does the degree of social distancing, the time spent social distancing, and time spent outside affect a person's positive, negative emotion, depressive or anxious symptoms, and loneliness? We took a sample of 732 people, happened to be mostly women, and we did snowball sampling through the UCR Sona system and then allowing them to pass it on through social medias. We collected the data at the beginning of the pandemic in March and April, and we just provided a survey to all of these participants, asking them about their lifestyle regarding the COVID-19 pandemic. So what did we find? We found that more social distancing was associated with less loneliness, less positive emotion, more negative emotion, and more anxiety. Dazed social distancing did not associate with any of these well-being measures, and time outside predicted less loneliness, less anxiety, and less depression. So for the most part, our hypothesis was supported. Social distancing practices did decrease overall well-being, and time spent outside did increase overall well-being. The part that was unsupported was days spent social distancing did not seem to affect well-being at all. And surprisingly, loneliness decreased with more social distancing practices. It was the only association that increased well-being. And we think that this is because we took the data at the beginning of the pandemic and we had continued connection with people around us through social media platforms, Zoom, and things like that. So that, for the most part, is what we found. And so I want to thank Dr. Kate Sweeny in the Life Events Lab for helping us do great research.
Hi, I'm Jordan, and I'm a graduate student in the developmental area of the UCR Psychology Department. I work with Dr. Karynna in the KIND lab. Today, I'll be presenting some work we've done with a sample of 56 Latina girls and their parents residing largely in the Inland Empire region of Southern California. For this study, parent-daughter dyads completed 4 online visits throughout the early months of the pandemic. And during these visits, we looked at a variety of things like coping, empathy, distress, and prosociality. But for the analyses that I'm presenting here, we were specifically interested in the impact of coping behaviors on mental health throughout the pandemic. So first, correlational analyses revealed parents' pandemic-related distress at visit 1 was associated with parent-reported daughter anxiety at visit 4, such that as distress increased, so did parent-reported child anxiety. And next, we found parents' general dysfunctional coping across visits 2 and 3 mediated the link between pandemic-related distress and parent-rated child anxiety. However, these effects were not observed for children's self-reported anxiety. And finally, among the many stressors that we tested, distress in response to food and job insecurity specifically emerged as significant predictors of dysfunctional coping. So as financial distress increased, so did dysfunctional coping strategy use. In conclusion, parental dysfunctional coping in response to pandemic-related distress may be an important catalyst of parent-rated child anxiety. And parental coping strategies in response to financial distress in particular may be an important prevention target in reducing the burden of mental health in Latinx families and other disproportionately affected communities. Continued research is needed to elucidate how coping and psychological distress contributes to parent perceptions of maladjustment relative to children's subjective experiences during the pandemic. And lastly, a big thank you to our participating families for their valuable time during a really difficult year. Thank you.
The title of our talk is The Impact of Personal Factors and Learning New Skills During the COVID-19. Participants of all ages were recruited from the Inland Empire. Some of the older adults recruited for the present study participated in a prior cognitive learning intervention, which was found to increase their overall objective executive functions. So we were able to see how their resilience differed in comparison to other adults who did not participate in the intervention. For this study, we had 3 main research questions. In the first question, we were interested in looking at intervention status in order to answer how is self-reported cognitive abilities, specifically executive functioning, related to loneliness during the pandemic. Our second question asked, how does growth mindset, belief in improving abilities and intelligence impact younger and older adults' well-being and adjustment to the pandemic? Lastly, we asked, how do personal factors and learning behaviors affect depression and social connectivity during the pandemic? To answer our first question, adults completed a self-reported executive functioning questionnaire and questions about perceived loneliness. We found that older adults who participated in the prior cognitive learning intervention and self-reported worse executive functioning during the pandemic felt more lonely compared to older adults who did not participate in the intervention.
Examining this second research question, we found that the higher growth mindset the participants have, less depression symptoms, and higher well-being they report in younger, middle-aged, and older adult samples. However, when it comes to the adjustment of daily tasks, the effect of growth mindset is significant only among older adults over 60 years old.
We also found that adults who participated in the skill learning intervention had improved social connectivity compared to those who did not participate. We also found that low income is associated with high depression. When comparing young adults, we found that younger females had more severe depressive symptoms than younger males, but we found the opposite pattern for middle-aged adults. Finally, we observed the surprising result that engaging in new behaviors was related to higher levels of depression. Together, our findings show that there's great diversity in the way mental health has impacted adults during the pandemic, and that mental health may depend on age, sex, income, mindset, willingness to adjust, and willingness to learn new skills.
Hi, my name is Sneha Hirulkar, and I am a research assistant for Dr. Kate Sweeney's Life Events Lab in the Department of Psychology at the University of California at Riverside. In this investigation, we wanted to explore how adults in the United States were coping during the early phases of the COVID-19 lockdown, and whether certain coping strategies and worrying about contracting the coronavirus that caused COVID-19 impacted social distancing behaviors. Being in lockdown meant that most places were closed and only essential businesses remained open. This led to the majority of the US population being confined to their homes and becoming socially isolated. Data collection was done in April 2020 with the emergence of social distancing guidelines. The Center of Disease Control and Prevention, CDC, defined social distancing as maintaining a 6 feet distance between two individuals, hand washing for at least 20 seconds, usage of masks in public setting, and limiting time spent outside of the immediate household in order to decrease the incidence of COVID-19. We looked at 5 different coping strategies: proactive coping, preventive action, information seeking, bracing, and distraction efforts. Of these, proactive coping, preventive action, and information seeking were grouped as approach-oriented coping strategies, whereas bracing and distraction efforts were grouped as avoidance-oriented coping strategies. We found that utilization of all 5 coping strategies led to more social distancing. We also found that more worry led to more use of these 5 strategies. Interestingly, however, approach-oriented coping mediated a link between worry and social distancing, but avoidance-oriented did not. Our findings suggest that worried people engaged in both approach and avoidance-oriented coping strategies, but only approach-oriented strategies translated into risk-reducing behaviors. We speculate that the social distancing behavior observed when utilizing bracing and distraction effort coping strategies did not directly motivate the risk-reducing behavior, but rather emerged more directly from worry about COVID-19. Thank you.
Hello, my name is Lilian Azer, and I'm a graduate student in the Cognition and Cognitive Neuroscience program in the Psychology Department. Today, I will share with you my talk titled Self-Reported Executive Functions During the Time of COVID-19 in Relation to Social Distancing Compliance, Consumer Buying Behavior, and Loneliness. In our study, we were interested in answering the following 2 research questions. First, could executive functioning predict some key social behaviors, including social distancing compliance and panic buying during the initial stage of the California stay-at-home order? From our previous study, we know that individual differences in working memory capacity could predict social distancing compliance. Basically, choosing to follow the social distancing norms and putting societal benefits over personal costs is contingent on working memory capacity. Second, how is executive functioning associated with mood-related individual differences, specifically perceived loneliness? We know that research pre-pandemic shows that there is a bidirectional relationship between perceived loneliness and declines in both subjective and objective cognitive functioning. Since the beginning of the pandemic, research has shown that perceived loneliness increased as a result of social distancing restrictions, and loneliness experienced in relation to the duration of social distancing is associated with working memory errors. We collected data from 314 undergraduate students from the University of California, Riverside between April 2nd, 2020 and April 16, 2020. We measured self-reported executive functioning, social distancing compliance, consumer buying behavior, and perceived loneliness. We found that self-reported executive functioning did not predict social distancing compliance or consumer buying behavior. However, organization of materials or orderliness of work and living spaces, which is a subscale of overall self-reported executive functioning assessment, was associated with social distancing compliance. Individuals who reported having a high level of organization in their daily lives were more compliant to social distancing practices. A sense of structure during an uncertain and unstructured time may have promoted an increased cost and benefit awareness of restricting pre-COVID-19 activities. To address our second research question, we also found that increased feelings of perceived loneliness during the pandemic was associated with worse self-reported executive functioning. Loneliness may elicit negative thoughts and emotions, which can promote stress and lead to worse sense of loneliness. Promoting engagement in daily rituals can reduce perceived loneliness, which may also increase the likelihood individuals will develop strategies to facilitate new behaviors, such as complying with social distancing norms. In addition, seeking social support may help reduce perceived loneliness and improve overall cognitive functioning.
Hi, my name is Idalis Rivera-Ramirez, and I'm a research assistant in the Life Events Lab at UC Riverside under Dr. Kate Sweeny in the Psychology Department. Today I'm going to tell you about some of my favorite COVID-19 research, specifically humor and COVID-19 memes. So for some background information, we were interested in looking at whether humor style preference predicted appreciation for COVID-19 memes depicting various styles of humor. So when looking at humor and coping, humor assists in distancing us from negative experiences. Humor and laughter can be therapeutic for relieving things like tension and anxiety, and humor can help us perceive situations as being less threatening. Overall, the 4 humor styles are categorized into 2 categories, adaptive or maladaptive, with the 4 humor styles being affiliative, self-enhancing, aggressive, and self-defeating. So we had 352 participants with an average age of 24 complete an online survey on Prolific. They rated their appreciation of COVID-19 memes and were randomly assigned 25 memes out of a total pool of 300 COVID-19 memes. Each meme was rated on a scale of 1 to 5 on the following questions: how much they related to it, how funny they thought it was, how much they liked it, and how much it made them feel seen, and overall how much it made them feel nostalgic, in addition to completing a humor style questionnaire. So when coding the memes, each of the 4 humor styles were coded using the following humor style themes. And overall, we found that the majority of the COVID-19 memes that participants were given in the total pool were mostly affiliative, with second place being self-defeating, aggressive, and so on and so forth. So for our results, we found that participants who were higher in the aggressive or self-defeating humor styles liked memes of that respective style more on average. So when they completed the humor style questionnaire, if they were found to prefer aggressive or self-defeating humor, they also preferred that same humor in the COVID-19 memes. Additionally, participants who were higher in the affiliative and self-enhancing humor styles appreciated memes of self-defeating and aggressive styles. Self-defeating humor style predicted appreciation of aggressive humor memes, and aggressive humor style predicted appreciation of self-defeating humor memes. Findings suggest that people seem to be using memes to cope with COVID-19 and that people prefer self-defeating and aggressive humor styles in the context of COVID-19 memes, regardless of their humor style preference. And that's all. Thank you so much.